I'm Emmy, and I am presenting on my internship location, which is Madrona Recovery out at the Tigard location. It's a teen recovery center that focuses on short-term, secure inpatient care for teens 13 through 17 years old, short-term meaning around 30 to 45 days. Their focus is on mental health stabilization and substance use detox and relapse prevention. Their mission is to serve youth and families who are struggling with mental health and substance use in navigating the path from crisis to opportunity. Their value statement is that youth struggling with those conditions should have access to effective, compassionate treatment when they need it, and that parents and caregivers should also be given the tools to support their youth in that recovery process. As far as the services they offer, they do one-on-one family and group therapy for each client. The day is filled with 8 treatment groups per day that are focusing around education, skill building, mindfulness, resilience, emotional regulation, communication, and conflict resolution, around setting healthy boundaries. They educate the families and guardians so that they can match these intentional skill building that the youth are going through, and so that they are not returned to the same environment with the same poor communication that they may have come out of. And then they're really dedicated to trying to make it a fun environment while keeping them safe. The history. In 2016, John Thornton, who is the CEO and founder, came up with the idea and founded it. He had noticed that there was definitely a need, and that there were only, I think at the time, 3 facilities in all of Oregon, and there was just long wait lists for kids seeking services, and especially after COVID-19, it got even worse. And so he noticed that there was definitely a need for it. He cared a lot. He'd been in the industry for 25 years, working in residential care for teens and as a teacher and mentor. So in 2017, he opened up the Tigard location. You can see kind of the recreation outdoor area in the upper picture on the right. It has grass where the wood chips are now, but it's 3 wooden facilities. There's goats, there's basketball court, there's just nice open areas that people can hang out outdoors, and then of course the classes and dorms and everything inside. Then in 2022, they became the first organization of this type in Oregon to offer a detox withdrawal program for adolescents so that they could meet and serve clients who had a little bit higher need. If they are still a severe case and need more intensive medical attention, then they're definitely still stabilized in a hospital before bringing them over to our facilities. But we're able to serve a lot more kids because of this program, and that required creating certain environmental changes and then also education for the nursing staff so that they would know how to take care of them. And then last year, they received some funding and were able to improve the security of the facilities and do a grand reopening and start development for the Brush Prairie, Washington location, which they opened up last month or 2 ago. And so now there's a new location with the potential to house up to 40 kids. At the moment, they're still getting it going, and it only has one of the many halls open. And so I think there's somewhere around 6 clients there at any one time. But they have the potential to hold up to 40, where Tigard is holding around 20, usually 18. The bottom picture is the front facility of the Brush Prairie location. Next month, next door to the Tigard facility, they're going to be opening the outpatient service center so that they can be helping the kids who are coming out of intensive inpatient get the support that they need, because when you're done with inpatient, you need intensive outpatient services, a continuing therapy, continuing substance abuse support, continuing family support. And they noticed that there was definitely an area of opportunity there, so they've created a facility next door to be able to support some of the kids coming out of our program, but a lot of the other youth in the community. Policies and funding influencing their services, there's a lot. So there's the Commission of Accreditation of Rehabilitation Facilities, CARF. They're handling international standards, and they're focused on like customer satisfaction, making sure that it's quality facilities. The Joint Commission is ensuring compliance with national standards. They really focus on continuous improvement, patient safety, and ensuring better outcomes. Then at the local level, we've got Oregon Health Authority, OHA, which dictates the rules of operation, licensing, and funding for secure residential adolescent inpatient program. And because those rules are really complicated, the Oregon Administrative Rules, OARs, help translate those rules of operation and help agencies implement and interpret them. The Oregon Revised Statutes, ORS, offers federal guidelines and funding for organizations who are promoting mental health. And since we work on mental health stabilization, Madrona is able to receive some of that funding and guidance. And then the American Association of Addiction Medicine, ASAM, is actually the assessment that we do in order to decide whether they should have inpatient or intensive outpatient services. So every new client that comes through the door at the outpatient and the inpatient facilities receives ASAM at start and end to be able to measure the need for level of care and then to ensure that they are making progress toward their goals and going down the level of care that is needed. Then for funding, last year in March, Madrona received $3 million in combination from OHA and Oregon DHS, and they were able to use that to improve the security of the facilities, to expand their detox services, to offer a lower staff to client ratio. So putting some of that money into the staffing of the facilities, that's nice because it means we only have 3 clients per staff member so that there's more attention, supervision, and safety. And then they also put some of that money into building the new Brush Prairie location. As for general billing, they take insurance. And so people can pay cash, but insurance covers it. Since most of the kids are coming from foster care and welfare system, they bill Medicaid, state welfare, child and family service funds to be able to support those services. My time is spent there mostly doing micro, but then I got interested in also dabbling in the meso and macro levels. So on the micro level, I'm designing group content, leading and co-facilitating weekly groups with the youth, engaging with them one-on-one when I'm out on the floor outside of the groups so that I can build rapport, observe their needs, their growth, and then also support their needs if they reach out or trust me to do so. I did shadowing in case management and the substance use ASAM placement assessments and have not yet been able to step into that role, but next term I'll be moving over to the outpatient facility and doing ASAM placement assessments on new clients who are coming in, deciding whether they should be in the outpatient or inpatient programs, and then also following them as their case manager through the intake, assessment, intervention, and termination phases. Then, as I said, I wanted to be able to help improve the organization. I found it frustrating that there were some limitations and definite areas for improvement. Luckily, I'm not the only person who saw that need, and so the organization has already hired a specialist who is working on quality improvement, and so I got to be wrapped in with those macro social work students working on the organizational level. So for that, I informally interviewed every level, supervisors, staff, interns, and clients about their experience at Madrona, and have designed a survey for the staff. I'm designing another one for interns in order to assess current trainings and practices and identify how we can make improvements there. And then on the macro level, investigating policies that impact the organization, the program, and the clients, trying to look for areas for advocacy and policy change and just generally more macro involvement. As a second year internship opportunity, if you're interested in this population, there are amazing opportunities at this organization. You can do you will be, as a second year clinical intern, you would be doing one-on-one therapy with teens. You'd have 1 or 2 clients generally at a time. You'd have direct supervision from one of the 3 staff therapists who are overseeing your client with you, but you'd also have the clinical supervisor and the social work supervisor. And then you'd get a lot of experience working with a really complex youth population. You'd also be leading and co-facilitating the weekly therapeutic groups where you're getting to create your own content. You're writing up soap notes for all of the clients who attend your groups. And you would be facilitating adult and family therapy, so helping strengthen the relationship and communication and repair between the families or the guardians and the clients, so that they're not coming out of a toxic environment, going through all of this work for recovery, and then being put right back in the soup that made them. So it's definitely helping to facilitate growth for the guardians, and also to make sure that the guardians are not surprised or offended by the very direct and intentional communication skills that the kids are learning. And then, as I said, with the Tigard Outpatient Recovery Center opening up, you would have the opportunity, if you wanted to work over there, with doing the ASAM assessments, one-on-one therapy with outpatient clients, leading some of those teen recovery groups, and then possibly leading groups for the parents of the teens who are in recovery. So if you have any questions, feel free to ask me outside of class. I think it's an amazing opportunity, although it is a very stressful environment.